lovely? Isn't she wonderful? Isn't she precious? Less than 1 minute. Oh, I never thought true love is be making one as lovely as she. But isn't she lovely? Made from love. Isn't she pretty? Truly the angel's best. Boy, I'm so happy we have been heaven blessed. I can't believe what God has done. Through us He given life to one. But isn't she lovely? Made from love. Do 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 do. Do 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 do. Do 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 do. Do 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 do. Do 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 do. Do 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 do. Do 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 do. Isn't she lovely? Life and love are the same. Life is Asian, the meaning of her name. Lord, it could have not been done without you who convinced the one. But isn't she lovely? Made from love. Good.
And make those embers glow. I'm on my way, and I don't skip a beat. I can't help it, I've got happy feet. So good, I do what I want and it's understood. There's no stopping me when I'm doing my thing. I'm doing my thing. I'ma do me. You know what I mean. I'm on fire. I'm feeling glad there's a spark in my soul. Feel my heart goes in. I'm clapping my hands and I'm pulling these strings. No stopping me when I'm doing my thing. I'm doing my thing. I'ma do me. I'ma do me. You know what I mean. You know what I mean. I'm on fire. Yes, I am. I'ma do me. I'ma do me. You know what I mean. Oh, you know what I mean. I'm on yes, I am. I'm on fire, yeah, yeah, yeah. I'm on fire, yeah. I can't seem to focus, and you don't seem to notice I'm not here. I'm just a mirror. You check your complexion to find your reflections all alone. I had to go. Can't you hear me? I'm not coming home. Do you understand? I've changed my plans, 'cause I'm in love.
Isn't she lovely? Isn't she one?
I can't seem to focus, and you don't seem to notice I'm not here. I'm just a mirror. You check your complexion to find your reflections all alone. I had to go. Can't you hear me? I'm not coming home. Do you understand? I've changed my plans, 'cause I'm in love with my future. Can't wait to meet her. And I'm in love, but not with anybody else. Just wanna get to know myself. I know supposedly I'm lonely now. No, I'm supposed to be unhappy without someone, but aren't I someone? You're so handsome, but I know better than to drive you home. 'Cause you'd invite me in, and I'd be yours again, but I'm in love with my future, and you don't know her. And I'm in love, but not with anybody here. I'll see you in a couple years.
Hello, good morning. We are live. Thanks for joining, everybody. For those of you who are joining live, can you please give me a feedback and regarding audio visual? Can you see me okay? How's the sound? Is my voice coming through all right? Okay. Please let me know. Good morning, Bright Chang, Steven, Shane, TV Back, Sanyar, Caitlin, Sylvia, Bernard, Ten again. All right, thanks everybody for joining live. All right, excellent. Okay, so let's start this morning session. Let me just go picture in picture. Okay, so I try to do a daily live coffee show during the holiday break, and so we are at episode 7, believe it or not. And today is a weekly Ask Me Anything episode. So I'm going to answer some of the questions that some of you guys been private messaging me. But today is basically going through some of the question that was left over from the last time. Okay, yeah. All right. Excellent. Hope you guys can hear me okay. All right. Sounds great. Okay, thanks Kevin. Thanks for letting me know. Okay. Yeah. Yeah. So the question that was left out last Sunday was removing broken screw. That was a question, and actually there was a case that I worked up and I want to go through, but I just didn't have the time to go through that. So today, that's what I'm going to cover today. Okay, hope that's okay with you. Now, broken screws is something that does happen, used to happen a lot in the past. Like when we used to use external hex system, a lot of pressure went over the screw instead of the wall of the implant. So in those days of a Brandemark MK3, external hex Nobel Speedies, things like that. Because guys, like in the past, there were times where external hex used to be the dominant connection, and because of the design, when they were bruxing or chewing the back teeth, a lot of stress goes to the screw, and then oftentimes the screw either loosen or sometimes it will fracture out. Okay. Now with the modern design, like a Morse taper, like a Megazin Anyone, or Megazin Any Rich Morse taper, or conical connection like an Anyone or a Highest ET3 and things like that, Astras. The connection, majority of the connection these days are conical connection that's out there, and conical connections they bind pretty tight to the fixture, the abutment, so we get less of a loosening. But what we see more in exchange is, of course, the wall fracture, implant fracture. So can't win, right? Can't win either way. So today I will go through about broken screws, and there was a doctor who says, "Hey Mark, what suggestion for tools and instruments for removing broken screw in implant? I tried to drill through it, did not work well. So I drilled a hole through screw, but couldn't get it out either." So I do have a couple of the popular screw retrieval kit that I'm going to go through with you today, hopefully. Okay, all right. So this was one of my case, right? One of my patient came in, I think it was about 3 weeks ago. 3 weeks ago, I said, "Hey doc, I spent a lot of money. Had this crown done about a few years ago, and what's going on," right? Okay, so what do you see here? I was quite shocked, okay, because it's rare to see two crowns joined together on a custom abutment with a conical connection with a fracture line. Not only the screw fracture right here, as you can see right here, but there's also a shear force caused a crack on the abutment itself. Okay, and you can see all these scratch marks, right? Okay, so obviously what causes the fracture is a force force, right? The why is that the patient is probably a non-bruxer, and it's the force that caused the fracture like this here commonly. Not necessarily during eating, because oftentimes the patient will say, oh, I don't eat anything hard, doctor. Okay, it's not my fault. Well, it's at nighttime. So this was the x-ray that we took, and if you look carefully right here, all right, and carefully right here, here is the broken screw still embedded right in there. Okay, now these screws, right, these fracture screws, it can either come out really easy or really difficult, right? So let's look through the history of this case right here, right? So if you look at it, one on the very left side, this is a patient that came to me in 2014 in November the 12th, and he wanted a full arch treatment. He had really good bone. His teeth were super worn out. Okay, so right off the bat, I knew we were dealing with the cause of a lot of this failure is his occlusion. Okay, because certainly this is not a perio case, right? So you got to determine whether it's a perio case or cavities, or what's the third one? Occlusion, right? So this is a case that I knew going in that managing occlusion is going to be a big challenge, right? So we give an option of obviously either full arch or doing a partial implant therapy with regaining vertical by his dentist doing a crown works on the rest of the teeth. And the patient was a lawyer, right? It's very logical thinking, understands, very smart guy, right? He says, you know what, he doesn't like his teeth. He wanted to get rid of them and get new teeth, right? And we do have to watch out for patients' simplistic thought process, because sometimes patients think that get rid of my bad teeth, doc, I'll pay you a lot of money, you give me good teeth, and the life is going to be all great. Well, it's not, right? We have to understand that doesn't matter how good of a treatment it is, when you replace the existing problem, sometimes you can gain a different problem. Right, different problem. It's not like buying a brand new car and drive 5 years, under the warranty, and everything's good, and after 5 years get a new car. It doesn't work that way, right? Okay, so long story short, we gave him. This is before the FP1 procedure. If I were to do this case over again, I'll probably do an FP1, not FP3. But this was the time that we just started to, play around with a different material, because we experienced a lot of breakage problem with FP3 hybrid cases with a patient with a really bad force, a lot of excessive occlusion force. So as you can see here, we gave him a teeth in a day, and on the bottom we also placed this implant, and we gave him a chair side temporary crowns as well. Okay, so that's what he used for the next 4 months. And then, of course, we did the sinus elevation on the posterior. And then 4 or 5 months later, give him a final crowns on the bottom, and also a final wraparound bridge, which is a zirconia. How do you know this is a zirconia bridge? Because it's very radio opaque. Okay, this is a full contour zirconia bridge. There's a problem with the zirconia bridge, right? The good thing is that it's so strong, and the bad thing is that it is so strong. So being too strong can be a problem. Patient with no proprioception after all the teeth gets removed, their ability to gauge how strong they are, biting or clenching their teeth, that diminishes, and it can actually make the force even more than what the patient used to be. And then in 2017, what you'll notice is a little bit right here, a little bit of bone loss around the tooth number 26 area. Okay, why do you get bone loss here in this case right here? Okay, can be different reason. We can always blame the patient for lack of hygiene, all that. But part of it is, one, is a force, I think. And second, I think, is the design of the bridge. We used to compress the tissue with these FP3 type of bridge work here. We were taught, and we were to compress the tissue so that it can cause an ovate pontic. And also this is what we were taught our residents as well. But later on I come to realize that that's not always the ideal pontic design, and I'm going to talk a little bit about that a little later. Okay. So in 2018, the area was exudating a little bit, so what we did was we removed the zirconia bridge, sent to the lab to create an embrasure space so that they can mechanically clean around the implants, all the implants, using a proxy brush. I find that that is the best way to maintain hygiene. And also meantime though, we put back the temporary bridge, initial acrylic bridge there, during the lab, a few days for the lab to modify the design. Now, before continuing on answering the broken screw, yesterday I got a question from one of the member. Is that the member saw my video Saubona, normalizing digital implant dentistry, when I got invited to a MINEC for the digital symposium. So check that one out. It talks about my journey of a full arch treatment. But anyways, the member was watching the video, and he wanted me to talk more about FP1, FP2, and FP3. So I'm gonna cover that briefly. Okay. Here it says, hi doc, I recently watched your YouTube video, the minimum bone reduction for all on X and respecting the biology. You mentioned that you use R2Gate for your stent and implant planning, and mentioned that they have some classes about this. Would you provide a bit more info on this? Okay, yeah, the problem is like a 30-minute lecture is that I cannot really go so much into detail. Okay, but what is FP1 and FP2 and FP3 is that let me see right here, is that FP1 is basically fixed prosthetic category 1, meaning that we're going right to the fixture oftentimes, and because of that we don't have the middle structure like an MUA. That means we don't need to reduce the bone like we traditionally do, because traditional full arch all on X type of prosthesis, like you can see on the right side over here, FP3, FP1 on the left side, FP3 on the left side, because we're using multi-unit abutment, which is the middle layer, we have to reduce a lot of bone in order to accommodate for the space for the multi-unit abutment, and also the thickness of the prosthetic as well. Okay, so that took a lot of space as well. All right. Okay, let me see right here. What can I show you? Okay, and yeah, so right there. Whoops. Right here, yeah. So that's the key difference is the thickness of it. So in order to have a prosthetic like this, we had to reduce a lot of bone in order to accommodate for that. And I come to a point where in my career, after doing about 1,000 of these, I didn't want to cut away bone anymore, because there's a other related problem that I experienced in my own practice. I'm not really going to get into that. So FP1 is when you have just replacing the teeth. FP2 is because of the bone loss, patient's bone losses, teeth sometimes looks a little bit longer. That's an FP2. FP3 is the bone. What you're replacing is not just the teeth, but also the missing tissue, like an FP3 right here. So in a nutshell, FP3 is a type of prosthetics that a typical traditional all-on X type of wraparound bridge is designed with, right? Okay, hopefully that helps. Okay, so a lot of the new bridges that you'll see on my post are going to be FP1s, right? Fixture level. And in order to do FP1, your implant position has to be far more accurate than just a traditional FP3. Because traditional FP3, like on the left side right over here, I did a freehand, and you have multi-unit abutment to correct the angulation, but not FP1, especially if you're going to go straight to the fixture level. So because the implant position needs to be very, very precise. That's why I use guided. And for me, best guide system I think at present time is MegaGen R2 gate. Okay, so let's come back to over here. All right, hopefully that answers the question. Okay, so now let's go back right here. So this patient had a full arch on the top and segmental implant supported crown and bridge on the bottom and excessive force. Something had to give, and upper zirconia crown bridge is very, very strong because it's wrap around, right? Even with the side motion, nothing is coming undone. So something had to give, right? And in this case, unfortunately, is the bottom right side crowns, okay? And the prosthetic screw basically broke off. This is the first time that I had two break at the same time, totally shear off on a case where crowns were fused together, right? There's a reason why I fused it, obviously, to over-engineer it, and despite that, it still broke. So whenever I do these cases, especially these cases, number one, I have to find out what the diagnosis is, right? Diagnosis is that it's excessive force, patient is a bruxer, and the screw broke off, right? Because if you don't have a diagnosis, even after you do the trim, it's going to happen again. That's the diagnosis. And patient knew it, and he came up with a plan. He says, "Doc, the night guard that you made me, to be honest with you, I wasn't wearing it, okay? And once I fix this one, I promise I'll start to wear it." You see, this is a problem, right? We give our patient, I give my patient night guard to prevent the future problem, but patients do things or buy into something not to prevent the future problem, but they buy, they purchase, and they do something in order to get out of the problem. That's why a lot of patients come to dentists when they have a problem, not to prevent problem, right? So that's that. And treatment option, what are the treatment options here? This is important, okay? Because whenever I get a referral for a case like this, or if this is my own case, in this case, my own case, okay, what kind of treatment option can we give, right? Well, obviously, the treatment option is that if the fixture is intact and the x-ray shows that the fixture is not damaged, okay, but you never know until you actually flap and go in, right? Because by the time patient comes in like this, soft tissue is covering all this, so you cannot really tell clinically what condition the fixtures are, right? So let's say that the fixture is intact and it's not damaged, and let's say that you want to remove this prosthetic screw. How predictably can you remove those prosthetic screws, right? There's no guarantee. There's no guarantee. And during the prosthetic screw removal, there's a good chance that you might actually damage the internal thread of the implant, which renders the implant fixture not very useful, right? So you have to, talk all that with the patient, right? Because the patient has expectation, right? Patient said, well, can't you just remove the broken screw and, just put back the existing crowns here? Well, in this case, existing crowns cannot be used because it's got fractured abutment. So the whole thing has to be redone anyways, right? And also, you need to discuss before you book the appointment, financials, who's going to cover what, okay? So what I did was this, okay? I had to hold myself back, pull myself back, and instead of trying to fix it right on the spot, I say, you know what, come back for proper consultation. Let me think about this case and let me give you treatment options. So I try not to do a quick fix because these cases sometimes is not a quick fix, right? So I brought the patient back in that same week and we had about an hour of proper consultation. I treat this like a brand new case now, right? Brand new case. And how long was this case done? Oh, wait, I'm curious. Let me just go back right here. It was done in 2015. Final crown was placed in 2015. Okay, so 5 years, right? 5 years, right? 5 years. So what we talked about was all these, right? Okay, we told the patient, you know what? There's a two scenario. There's a two possibility. There's a good scenario and a bad scenario. The good scenario is that I go in there, implant is still intact. I use my special tool to miraculously remove those two broken screws, okay, two broken screws, and then what we can do is take an impression, and you get a new crowns, okay, new crowns. Second scenario is that is a bad scenario, okay, which is a bad news, which will be, right, the prosthetic screw will not come out. Will not come out. If it does not come out, then I need to remove the implant on the same spot, and I can replace with a brand new implant on those two areas, okay. And depending on the scenario, patient is going to be being charged, okay, A or B. So it's important that patient understands, fully aware that there are two possible scenarios and the cost can be significantly different, right? Now this patient had a treatment done about 5 years ago, okay? If I want to give him a little bit of a surgical break, so I told them that if I end up replacing those two implants, I'll give him a 30% discount on the surgical fee. So that made him feel a little bit better, right? But I also told him, but my goal would be to remove the prosthetic screws, and if I can remove the prosthetic screw, I'll take the impression right on the spot, right, to save him a trip, okay? So this is the process. So case like this, I find that it's a lot more important to spend the time to prepare the patient's expectation rather than just to jump in and do the treatment. Now, I've had a post on what kind of tools I use to manage this type of complication. So one of my favorite instrument that I use to remove these broken screws is this drill with a teeth on it. Okay, it's got a very sharp teeth on it. Like Nobel makes it, Megagen makes it, but they actually work really good. And the idea is that you use this in the reverse, okay, in the reverse method, and it works really good most of the time. But it only works if screw is a little bit loose, right? If it's super tight, it will not work. The reason it works, I would say 7 or 8 out of 10 times, is because the screw typically don't break off like with the shear force. It happens over time. At beginning, it loosens, gets some movement, and its movement is so small, but patient don't realize it, or movement is so little that patient thinks that it's not a big deal, okay? And after a while, the luxating force caused the abutment and the screw to break off, right? Okay, so that's why a lot of these cases, 8 out of 10 times, I find the screws a little bit loose, and you're able to use this to reverse it out, okay? And in this case, what I did was it's a different case, remove the screw first, and then because this also had a fracture wall, it's my older case, and removed it with the reversing tool like we talked about, I think about a couple weeks ago, right? And then I placed the new implant and do the GBR with sticky bone graft at the same time, and then we sutured it up, okay? So we'll go into a little bit of a detail about this drill. It's fantastic reversing drill. So you can use this reverse mode in a slow speed handpiece, latch, or implant handpiece in reverse, and oftentimes you're able to get this out, okay? All right. Okay, so this was the case, right? Okay, so you gotta make sure you tell the patient know that these crowns cannot be reused even if you remove the screws. There are some cases that you can reuse them, but not in this case, right? So you need to observe the prosthesis very carefully, because you don't want to be telling the patient afterwards, right? There's some old saying, like if you explain before the treatment is a patient education, if you explain it after treatment is an excuse, right? So true. Okay, so we covered that. All right. Hey Marcus, Anis, Brian, thanks for joining. So I'm going to take the next 10 minutes discuss this kit. Okay, the kit that I'm going to explain to you. These two kit, Hyosin and Easy Screw Retrieval Tool, and the Megagen 911 kit. Okay, so let me just turn this on. My camera number. Okay, so hopefully. Hopefully I can adjust this right here. Okay, let's see if I can go through that. Let me go with, okay. Hopefully you guys can see this okay. All right, so there are two kits that I'm going to show today. All right, one is called a ESR kit, and the other one is a 911 kit. 911 kit is by Megagen, and ESR kit is by Hyosin. Okay, so these accessory kits, Korean companies make probably the best. So now this kit is not really technically all universal. Okay, however, like Hyosin ET3 and Megagen Anyone, they're compatible. You can also use oftentimes on other conical connections, such as like Nobel conical or Astra, with some limitation. Okay, so let me just go through how Hyosin easy screw retrieval tool works. Okay, yeah. Now Hyosin easy screw retrieval kit has two compartments, one on the top, one on the bottom, and one on the bottom, okay, here is called the abutment retrieval kit right here. Okay, abutment retrieval. So what you see here is it's got like a little threads on it. Okay, it almost looks like a fixture removal, like a Nobel Biochem universal fixture removal, but it's a little bit narrow in the diameter. So these ones you use it when the crown and the screw head shears off. Not only the screw is broken, but also the abutment inside is also broken. It often you see in an implant system with a very narrow conical connection abutment, like an ankylose. Okay, prime example. When ankylose breaks, because abutment is narrow, the screw can break, but also the abutment can break. And ankylose is one of the toughest case to salvage for me in my hands, because those conical connections, almost like a Morse connection, once it fuses after a few years of function, right? Functional occlusal force causes to really cold weld to that. It's almost virtually impossible. So like ankylose problems, I almost tell the patient, you know what, 50% chance that I'm not gonna be able to salvage those cases, right? So these are different diameters of abutment retrieval tool. Now here's an interesting one. Okay, this one is like a flathead Phillips driver, right? Flathead. Okay, this one is when the screw head is not broken but is stripped. So when the screw head is stripped over, right? If it's stripped, what happens is you cannot use a normal hex driver to reverse things out. So what you do is, okay, you use a round burr to basically drill the middle of the stripped screw head, and then what you do is you get a 331 or a very thin carbide burr to make a slot, and try to reverse this. Try to reverse it out. Okay, yeah, and oftentimes that works as well. So this is a pretty good kit for removing the damaged screw. Okay, and also the broken abutment, right? That's for the bottom compartment. The top compartment is quite interesting, however. Okay, what you'll see is this one right here. Okay, I don't know if you guys can see. Okay, yeah, what you'll see here is a very thin, long drill with a very sharp, pointy end. Very sharp, pointy end. And this one, what it does is, in reverse, it can actually make a hole through the broken screw. Okay, and how that works is like this over here. Okay, so this one, you put it on. Okay, let me use this one. No, not this one here. which is it? Okay. For example, right here. Yeah. So you use this one to put it onto the implant. Okay, implant, and then you go through with this one here, and then you, with a lot of water, you reverse. Okay, reverse drill, and this will actually create hole within the screw. Okay, that's pretty neat, hey? Okay, within the screw. Okay, and then once you do that, okay, right, you are able to use something like right here, very, very fine tip, and basically reverse the actual screw out. Very, very technique sensitive, very, very technique sensitive, and make sure that when you're using these drills, okay, you gotta put in a reverse, otherwise it will not cut. The reason I asked the engineers why they design to cut in the reverse is that during the reversing, it can actually reverse out the screw, broken screw as well. Okay, so that's how the easy screw retrieval tool works. Okay, all right. Okay, and let me talk a little bit about this one here, 911 kit. Okay, this one is more something that I would consider all-in-one kit. This one actually has a screw removal tools. That is the majority of these drills are for, right? But also for today's purposes, it's also got something like this right here. Okay, right here, which is their version of the reversing tool with the teeth on it. Okay, remember I explained to you on the slide, you reverse this and then it will grab the broken screw and reverse it out. Okay, so you have to use this slow speed or use the implant handpiece when you're doing this, and use lots of water. Use lots of water because it will generate heat. Okay, also it has this one right here. Okay, it's got some teeth on it. This is more for removing the stripped screw head. And this one is a little bit bigger. Okay, similar to the easy screw retrieval kit of Hyosin, but it's a 911 kit Megagen version of it. This helps to remove the abutments. Okay, broken abutments, and so does this one. Okay, all right. And here our CDA had to put the tape over because these parts come off so easily during sterilization, so they covered it off. So what is these ones, little ones over here? Okay, these are holders, right? These are little holders, and you put it on to the fixture if it's a conical connection, and then it helps to stabilize the drill while you're reversing it, right? Okay, so that you don't damage the wall of the screw of the implant. Okay, so it's well thought out. Okay, so that's that, and it's got a compartment underneath it. Okay, heavy duty torque wrench when you're using. So this one here, 911 kit, whereas a Hyosin has two different kit, right? One for screw retrieval and one for fixed retrieval. So you have EFR kit, easy fixed retrieval, and ESR kit, easy screw retrieval kit. So you need to buy two different kit, whereas Megagen is all in one. Okay, all in one. So just this one kit does both the fixture removal and also the screw removal. Okay, all right. So hopefully that was helpful. All right, it's not for everybody, right? It's definitely not for everybody. And oops, yeah. So most often used is this drill right here. Okay, so that's the case. So what did I do in this case here? You know, we lucked out. Okay, I was able to remove both of the screw part. Okay, and on the same time, I was able to take the impression and send that to the lab. But look at this right over here. Okay, right. He's been seeing his dentist for every annual basis, but they missed out on this decay underneath it. Okay, so now the question was, what do we do? Does he need another implant, or do I recommend the patient to take this tooth out and do a cantilever bridge? If the patient didn't have the bruxing problem like he did, cantilever bridge might not be a bad option, but because he has such a high occlusal force, a cantilever is something that I decided not to do. Okay, yeah. So in the future, he'll probably end up getting another implant. This is another patient right here. Okay, but this is a case that didn't go as well as I planned or I was hoping. Another gentleman came exactly about 2 weeks later, referred by a fellow dentist in my town. I had an implant done about 8 years ago. Is one of the implant direct, I think, yeah. And then a crown broke off and the screw broke off, and told the patient, go see Dr. Kwon, and he's just going to easily remove it, and then he'll send it back to him, and then he'll take another impression and make a new crown. Well, it doesn't often happen that easily. So again, I told the patient there's a good scenario and a bad scenario. Good scenario is that I use my special tool, remove the abutment and the broken abutment and broken screw, and then you can go back to your dentist, he takes the impression, yada yada yada. Second scenario is not so good scenario, where the screw cannot be removed, and even if I try to remove the abutment, there might get some damaged, and implant might not be salvageable. In that case, I have to remove the fixture, and that's exactly what happened in this case over here. Okay, yeah, I removed the screws, I removed the part of the abutment, but the other part was totally like embedded right inside here. So I reversed it out, but there's also still a deep down, there's a piece of abutment still stuck in there. And as you can see here, how did I remove it? I try to find some part of the implant with a drill. Okay, drill. Okay, so 557 long shank drill. I did a partial trephining, and then I reversed that out using a Nobel Universal retrieval tool here. Okay, all right, so that makes sense. So the morale of the story, right? What's the morale of the story here? Okay, the story is that for most of you, is it worth purchasing this kit so that you can retrieve your cases? I think it's good to know if you are doing enough implant, this kit will come in very, very handy, and many times it will really, save your bacon, right? Okay, but if you are a beginner and not doing implant that many, maybe it's just better to refer out to your local periodontist or surgeons or prosthodontist specialist who is more capable of dealing with these cases, more regular basis, right? In my town, there are not that many doctors who take on cases like this. Somebody else's, complication cases. I'm one of them. I get complication cases come to my office a lot, and I think that's also contributing to practice building for my practice as well. Okay, but how much are these kits? They're about $1,500 each kit. Okay, it's $1,500 Canadian, US, depending on if they're on a promo. And typically for implant company, if I buy enough implants, they'll throw one in there for me. Okay, so I have like several of these, and I have different type from different manufacturers as well. I cannot really say that one is better than the others. Sometimes the reality is I use one, and if I'm struggling with it for the next 10 minutes, I get my CDA to bring on another set, right? And I basically go through it until I can remove it or I cannot remove it, right? So that's the situation. Hopefully you guys found that interesting. Okay, yeah, Sam, good to see you. Hannes, Jim. Okay, so today's case was more of a specialty cases, complication managing, and complication is part of the everyday thing for me and managing, and it's gonna happen. It's gonna happen if we do implant a long enough time, right? Okay. So before I finish off, I thank everybody for joining this morning live session. And now that the holiday is over, I have to go back to work starting this week. I'll probably do a live coffee show once a week. Okay, once a week. And if there's any topic that you want to cover, then private message me on the Facebook chat, and then I'll try to incorporate that as a part of my presentation, weekly presentation. Before I go, I want to announce the 2021 monthly study club, and some of you are already member and joined and signed up for it. I highly recommend it. I think it's really, really great. It's a 3-hour monthly live study club where we do combine the lecture, live surgery, and also post-op discussion. So please do take advantage of it, and I think it's a fantastic way to learn. Okay, so hopefully you guys join, and I get to see you more often, during the online cases. And we'll have a live prize draw too. We have about 5 or 7 sponsors who donate gifts for us to do a live prize draw, so it'll be fun as well. Okay, so hopefully you guys take care, and I'll see you again next Sunday. Next Sunday will be at 9 p.m. our regular hours, because that's the best time for me to do a live shows. Okay, again, if you have any question, please reach out to me. You guys take care, be healthy, be happy. All right, see you later. Bye bye.